Good morning, good afternoon, and good evening from Toronto, Canada, and welcome to the Creating a World for All Ages, Developing a Plan of Action to Address Ageism in Your Setting. My name is Anna Sangster, Program Manager with the International Federation on Aging, and it is my distinct pleasure to be your moderator today and to be joined by our featured presenter, Dr. Vania de la Fuente Nunez, Technical Officer at the WHO and a lead author of the recently released UN Global Report on Ageism. This webinar today is designed for those who could not attend the masterclass on ageism at the IFA 15th Global Conference on Aging, so that more people around the world can be equipped with the relevant knowledge and competencies to become change agents who turn aspirations into action and help create a world for all ages. In this webinar, participants will be provided with detailed information about the strategies that work in addressing ageism and prompted to think about how these interventions could be designed and implemented in their context. Before we begin, I wanted to take the opportunity to briefly review a few housekeeping notes. The webinar today has been equipped with French simultaneous interpretation. To enable this function, please click on the globe icon at the bottom of your screen to select your preferred language. In efforts to create a more interactive session, please use the raise hand function to indicate if you have a question, and once called upon, you will be able to pose your questions. You're also encouraged to ask questions through the chat function along the bottom of your screen. Please keep your cameras off and your mics disabled until you are called upon. This webinar will be recorded, and the video recording and resources, including slide deck, will be made available to all registrants post-webinar, Lastly, I'd like to take the opportunity to acknowledge the support of the Government of Canada in the delivery of this important webinar, and thank you all for your time in attending. Now, without further ado, I'll turn things over to you, Vania. The floor is yours.
Thank you very much, Anna. Thanks to all the participants who are joining us today. As Anna was saying, the intention of the presentation and the webinar today, which will have a lot more interaction than past webinars, perhaps, is for you to keep in mind the following question, which is how can you turn effective strategies, so those strategies that we know work in addressing ageism, how can you translate those into your context? So how can you go about designing and implementing those strategies in your setting? So I'm going to start with a brief presentation, and after that, we'll have an opportunity to go over questions that may come up as I present. And at the very end of the session, the idea is that we have a more of an interactive dialogue where participants also share ideas or projects that you have underway to address ageism and that may be directly related, hopefully, to the strategies that I will be covering today, so that we can all learn about them, co-create, and also so that others who are joining us today can be inspired to turn aspirations into actions, as Anna was saying. So let me just start by sharing my screen for the brief presentation. And wait, please. Okay, so hopefully you can see my presentation in full screen. Anna, can you just verify?
Yep,
yes,
looking good on my end.
Great.
Cheers.
Okay, so in the next 20 to 25 minutes, more or less, what I will be doing is walking you through the 3 strategies that we have found to work in addressing ageism, giving you key insights about the specific strategy, how it works, and also then presenting one example. Unfortunately, I won't be presenting 1,000 examples given the time limitation that we have here today, but if you have specific questions, please don't hesitate to ask those. You will be able to ask them either through the chat or also by raising your hand, and you will be able to share them live. But before we get started with just the strategies that we know work in addressing ageism, I did want to very quickly go over the definition of ageism and also provide key insights in case some of you have not joined a previous webinar that we had on ageism or are just not that familiar with this term. So when we talk about ageism, we're really referring to 3 different dimensions, which are stereotypes, prejudice, and discrimination that we can direct towards others, but also towards ourselves on the basis of age. This means that when we talk about ageism, we're really referring to how we think, which are the stereotypes, how we feel, which is the prejudice, and how we act, which is the discrimination, again, towards other people or towards ourselves on the basis of age. A stereotype, for example, can be something like someone thinking that older people are a burden to society. So that would be a stereotype about older people. An example of prejudice would be feeling fear when encountering younger adults, which could be based on an assumption that younger adults are criminals, for example. And an example of discrimination would be if, for example, you devalue older adults or you make fun of younger people. Beyond the definition, I did want to highlight today, because this is one of the things that becomes very apparent in the Global Report on Ageism, and it is that ageism is everywhere and it affects us all. We know that it exists in our institutions, in our relationships, and in ourselves. We also know that it starts quite early on. So we know that children around the age of 4 are already aware of their culture's age-based stereotypes, and they start using them to guide their behavior and their feelings towards other people and also towards themselves. And I mean, another reason why we should be worried about ageism, and why I do encourage all of you, and I'm so grateful that all of you are joining us today to try to take action about ageism, is that it's not only prevalent and it doesn't only affect us all, it's also very harmful, especially in older age. So we know today that ageism affects all aspects of our health and well-being when we're older. It is associated with premature death. It also leads to poor physical and mental health, including the presence of chronic conditions, hospitalizations, including, for example, the presence of depression, and it also lowers our quality of life. So again, we should be worried about ageism, and we should all be trying to do something to put an end to it, given its high prevalence across the world and the fact that it has very harmful effects. Just to give you a figure in terms of the prevalence, we know today that 1 in 2 people are ageist against older people, with rates much higher in low and lower middle income countries. And in Europe, we see reports of younger people saying that they experience more ageism than other age groups. So again, highly prevalent and very harmful. So let's go over what we can actually do to address it. So earlier this year, on the 18th of March, we released the first ever UN Global Report on Ageism. And this report not only talks about the magnitude of the problem, the nature of the problem, and its determinants, it also presents what we can do to address it. So as mentioned by Anna earlier today, the focus of this webinar is precisely on what we can do to address ageism. So I will be speaking mostly about the 3 strategies that we know work in addressing this phenomenon. I will present an overview of these interventions and 1 example of each, given the time limitation, as I mentioned, but I do encourage all of you to go to the Global Report on Ageism to learn more about it. So to get us started, as you see on this slide, we know that 3 different interventions are effective in addressing ageism: policy and law, educational activities, and intergenerational interventions. Policy and law can address discrimination and inequality based on age, and they can protect our human rights. What's important about this strategy is that it works in reducing ageism against any age group. When we talk about laws, we should consider both national laws, which are the laws that exist within a particular country, but also international law, which are basically the legal responsibilities that and the obligations of signatory states in their conduct with each other and in their treatment of individuals within their state boundaries. Policies and laws aimed at tackling ageism are very varied, but they can include things like anti-age discrimination and equality legislation and policies that define specific actions to ensure adequate respect for the dignity and equality of status of all persons, irrespective of their age. They can also include policies that aim to change perceptions of older and younger people. And they can include human rights law, which provides a system that codifies the human rights of older and younger persons and makes those rights enforceable. But how exactly does policy and law work? Well, it works for 4 different reasons. The first reason why this strategy can work in addressing ageism is that a law or a policy can create the social norm that ageism is unacceptable in society. Being aware of the stance of one's community has been shown to impact the extent of prejudice that one may express, even when the attitudes are stated privately and there's no possibility of criticism from others. The second reason why this strategy works in addressing ageism is due to what is called deterrence theory. We know that outlawing a given behavior can reduce that behavior to the extent that sanctions are consistently imposed. For example, an employer may be less likely to discriminate when anti-discrimination laws are in place, given that these create an expected cost that is of a magnitude that equals the cost of the violation if the person is caught, in terms of attorney's fees, the fines that they may have to pay, etc. And then there's also the probability of being caught. So the higher the probability of being caught and the higher the cost that will be accrued if you violate the law. And if you see that these laws are consistently applied, then you're more likely to not try to violate existing laws. The third reason why this strategy works is due to what is called the theory of cognitive dissonance, which tells us that government level policies and laws, by forcing people to change their behavior, can eventually also change most people's underlying attitudes as well, because they would need to reconcile the dissonance between their attitudes and their behavior, which creates this confusion in your head, as you see in the image on the slide. And the last reason why we know that this strategy works is that laws and policies can help shape the environment that surrounds us, which can increase the diversity that we see, which can in turn then affect the degree of implicit bias that we can exhibit. For example, laws that regulate discrimination in the workplace can increase the presence of those representatives of the protected groups. Imagine that there is a law or a policy regulating discrimination in the workplace that pushes for having more of a multi-generational workforce. By having more of a multi-generational workforce, then those people working in that space will see that as normal. And then that would affect any implicit biases that they could have. Just to give you a sense of examples and also what exists in this space to date, let me start by saying that at international level, there is to date no international convention on the rights of older persons or the rights of youth. For those of you who are not that familiar with international conventions, these are legally binding documents which are enforceable by law and which outline the rights of a specific group. In this case, it would be older persons or younger persons, or addresses a specific issue. For example, there are conventions on torture. Any UN member state can ratify a UN convention, which means that they would be agreeing to abide by the rules that are set in that convention. But as mentioned, there is to date no international convention on the rights of older persons or the rights of youth. And we know that with regards to an international convention on the rights of older persons, UN member states have expressed different views to date. Of course, individuals, organizations can advocate for their governments to support these conventions, as there is evidence that they work in shaping national policy eventually, because, as I mentioned, member states would be agreeing to abide by the rules. At regional level, we do have some protections, but they're still not all in force, or they have some limitations. For example, in the American region, we have those two regional protections that you see on the slide. The first one is the Inter-American Convention on Protecting the Human Rights of Older Persons. And this is the first binding convention on the rights of older persons that enters into force in the world. And it safeguards older people's human rights. It explicitly prohibits discrimination on the grounds of age. And it entered into force in 2017. 8 countries have ratified it so far. And there is going to be at a point in time when a 10th member state also ratifies the convention, a follow-up mechanism will come into play. Until then, unfortunately, the follow-up mechanism of the convention is not yet in working. At the regional level, we also have what is called the Ibero-American Convention on the Rights of Youth, which specifies specific rights for people aged between 15 and 24. It entered into force in 2008, and it has 7 countries that have ratified it so far. Unfortunately, this convention does not have a monitoring system, but it does have a tracking system through which state parties are required to submit a report every 2 years. Let me just emphasize again the importance of these follow-up or monitoring mechanisms. Without them, a policy or a law can just be a piece of paper that has specific provisions, but if we don't have a follow-up or monitoring mechanism, it's very difficult to then see if the actual convention is having any meaningful effect at country level. So again, at least the Ibero-American Convention on the Rights of Youth has something in place, which is a tracking system, and we will see what will be happening with the Inter-American Convention on Protecting the Human Rights of Older Persons. Hopefully we will reach that 10th instrument of ratification or accession so that the follow-up mechanism can be effectively applied. And at national level, what we see on this slide is basically the number of countries that have reported to have national legislation and enforcement strategies against age-based discrimination. What you see at the very left of the slide is figures at a global level. So we see that in 2020, 90 countries reported having national legislation and enforcement mechanisms against age-based discrimination. 58 countries reported not having any legislation, and 46 did not report. But even of the 90 countries that report having legislation, I would ask the question of how many of them cover all possible spheres of life where one may encounter such discrimination. So we know that those countries that have started to advance or take steps to prohibit age-based discrimination, many of them have policies or laws specifically focusing on the labor market or the workplace. But again, we can encounter age-based discrimination in other spheres of life, like, for example, accessing services, or, for example, in education. So it's important that we consider not only whether a given country has legislation, but also whether that legislation covers all those spheres of life where we may be affected by ageism. It's also important to consider whether the country knows or the people in the country know about the law. Unless people know about the presence of a law or a policy, first, they're unlikely to follow it because they won't know what repercussions not following that law would have. And also, those who may have been wronged would not know that they can go somewhere and file a complaint. So it's very important also that the general public knows about the existence of these laws. If we move towards the second strategy that we know works, these are educational activities, which can basically enhance empathy and dispel misconceptions and reduce prejudice and stereotypes. They do this by basically providing accurate information. So they can dispel those misconceptions that we may all have about different age groups or about the aging process. This type of intervention is effective for reducing ageism against older people, but unfortunately, we don't know that much yet as to their effectiveness for reducing ageism against younger people. This type of intervention not only addresses those stereotypes and prejudice, but it also has a small to medium effect on knowledge of aging, including effects on information and those misconceptions that I was mentioning. Educational activities are quite varied. They can include instruction that transmits knowledge and skills. So for example, educational activities can entail a module that is integrated into a broader curriculum or a mentoring program. They can also include activities that enhance empathy, like virtual reality, role-playing, simulation, and many more. The latter, so these empathy enhancing activities, they allow participants to imagine or experience the world from a different perspective, which then helps them challenge stereotypes and prejudice. This type of intervention can be delivered face-to-face, but also online, and in both formal and non-formal settings. What I mean by formal settings, this would be things like schools or universities. So these are formal educational settings. And non-formal educational settings where you could design or implement this type of activity would be places like community centers or workplaces or other such settings. In terms of how they work, well, we know that, and I was talking about two different types of educational activities, those that are based on information or transmitting information, and those that are based on enhancing empathy. For the first type, so information-based educational activities, for these ones, providing that accurate information and counter stereotypical examples can help dispel misconceptions about a particular age group. And they can also, these types of activities can also teach more complex thinking skills, which can then allow people to consciously reconsider and update their beliefs, their feelings and behaviors, and ultimately lead to that decrease in ageism that we want to see. And the second type of educational activities, those that focus more on empathy, these can help to increase emotional engagement, compassion, and the desire to help. So again, they work based on different types of mechanisms. And of course, you could consider designing an educational activity that integrates both that transmission of knowledge and skills, as well as an empathy enhancing activity. So they're not incompatible, you can combine. In terms of an example, so here I'm not, I'm only sharing one example again, given the time limitations that we have today, but this would be an example of a role-playing workshop where you would have a series of scenes or real life situations in which people would then act out that situation, and that would then be followed by a discussion of their feelings and the action that they can take. Real life situations can include things like a situation that may occur when you're accessing transportation or healthcare or in the workplace. And the roles can include an older person, a person interacting with the older person, two bystanders, or whatever combination you think could work in this role-playing scenario. But what I'm going to do now is read you an example of a role-playing scenario that could be considered for future workshops and that has been used in the past. So in this scenario, we would have a first role who would be an older person who is at a queue at the hospital, and they are next in line to be seen by the doctor. The older person has a lot of pain in their joints and is finding it hard to stand. They have traveled very far to get to the hospital, and the son of this older person dropped the older person off, and he cannot come and fetch the older person for another 3 hours. That would be the first role. The second role in this scenario would be a doctor who's working in that busy hospital. He sees or she sees that a few people are queuing to be seen by the doctor. They include a baby and their parent and an older person ahead of them in the queue who has to lean on a chair because they're having trouble standing. The doctor is unfortunately short-staffed because one of the nurses on the ward is sick. Then we have a third role, who would be the parent of that baby who is sick. The baby is crying and the waiting room is crowded. The parent can see that there's an older person in front of them in the queue. And fourth, we have a role who is someone who's working in the hospital trying to organize the busy waiting room. This person is talking people's, they're taking people's names and asking them what they need to see the doctor about. This person is quite tired and it is well past their lunchtime. So the role play exercise in this scenario that I just described of those 4 roles would be that the older person has been waiting to see the doctor and it is their turn. They tell the doctor about the pain in the joints, but the doctor doesn't seem to be listening. The doctor tells them that there are many other people to be seen and their symptoms seem to be due to their old age. The doctor suggests that the older person goes away and comes back another time when it's less busy. The baby's parent is agitated because their baby is not being seen. And the question to the people exercising the different roles would be, what do you all do? So you see that by providing those participants in this role-playing exercise or workshop with this question, they would need to explain what they would do and then also have that reflection as to why they're doing that specific action. And the good thing about these types of exercises is that they're often followed by a discussion where participants can share their feelings or how they felt in a particular situation. And it's often very good that people switch to roles that are not normally their own. So for example, if you were to design a role-playing workshop in the hospital, it's important that a nurse or a doctor does not always take the role of the doctor or the person taking the names of the people attending. It's important that they place themselves in the shoes of the older person and of the parent as well, so that they can experience that same situation from different perspectives. The last type of intervention that we know works in addressing ageism is intergenerational interventions, which bring together people of different ages to work cooperatively on tasks. These are quite varied. Again, they bring people of different ages together to work on tasks that are of mutual interest to them. So they can come together to share stories or paint, do gardening, or do as many things as they have common interests, no? Those two people that come together. They are effective in reducing ageism against older people, and they also show promise for reducing ageism against younger people. Intergenerational interventions can involve both direct or indirect contact. Direct contact involves face-to-face interactions, which can occur in different contexts, such as I was saying, older and younger people doing gardening together or playing games or engaging in music therapy or teaching one another about different things that they may be good at. Indirect intergenerational contact interventions entail participants being exposed to another age group without that direct or face-to-face encounter. And this indirect contact can be extended or imagined. What we mean by extended indirect contact is what happened when, for example, a friend of a similar age is known to have friends in another age group. And this is based on the idea that a friend of mine is a friend of yours, sorry, is a friend of mine. And what we mean by imagined contact is something that works by asking people to imagine having a positive encounter with a person from a different age group. The way that this strategy works is through what we call intergroup contact theory, which says that facilitating contact between groups under optimal conditions can reduce intergroup prejudice and stereotypes by reducing anxiety about intergroup contact and increasing perspective taking and empathy. And this is logical in the sense that when we interact with other people, we are forced to see the singularities of that person that is in front of us. And that process can help us challenge any misconceptions or stereotypes that we could have about the age group that that person may belong to. An example of this type of strategy would be home sharing, which is situations where older people provide housing to university students, and in exchange, students help to prevent social isolation and loneliness, and can also help with some small errands around the house. This is an example of sustained intergenerational contact. Not every intergenerational intervention has such a sustained contact. But what happens here is, or what is important here, is that careful matching of older people is done with students who need accommodation. It's important that in these types of interventions, We pay attention to the mutual expectations of both the older and the younger person, their interests, and their personal histories. This is a model that started in Portugal and has spread to some 16 countries, which goes to show how much interest there is to provide this type of intergenerational intervention across the world. So now that you know what works in addressing ageism, so now that we have gone quickly over the 3 strategies that we know work, so policy and law, educational activities, and intergenerational interventions, it's time for you also to think about which of these strategies, and it can be more than one, you may be best placed to take on. You can start by asking yourself whether policies and laws exist in your country to protect against ageism, who's covered by those policies and laws, are there specific exceptions, are there effective enforcement mechanisms in place, or are they being effectively implemented? If not, what is missing, and could you help cover those gaps? Also, do you know of any educational or intergenerational activities that aim to address ageism in your community or in your sector? How could you help to develop those types of activities to address ageism? And who would need to be involved? And this last question is particularly important for intergenerational interventions, because again, you may be joining us and you may be working in a school, for example. So you have easier access to children, but you would need to think about who would need to be involved to then partner up and make sure that older people come in to participate into that intervention. So once you know what it is that you want to focus on, the next step would be to develop an action plan. And of course, we won't have time to do this today, but what I did want to do is to close the presentation before the question and answer session by giving you some guidance on the key questions that you should be asking yourself when developing this plan of action. First one is, what will be done? Where will it be done? Who will do it? Again, thinking about those partners as well. When will it be done? How much will it cost? How will you communicate about it? And this is important to, for you to determine and know what and when you need to communicate so that you can effectively share your plan and ensure that all of the relevant actors are informed and involved in the actions that they need to take. You should also be asking yourself, how will you monitor and evaluate? An action plan can at times be altered or set aside, but you won't be able to realize that this is happening if you don't establish a baseline and monitor your action plan closely. You will also not know if you've actually achieved what you set out to achieve if you don't monitor and evaluate. And last but not least, it's important to consider what barriers or resistance might you encounter. So it is likely that you may face specific barriers. If you can think of those in advance, that can help you design a plan of action or a plan B in case you do end up encountering those barriers as you set out to implement your plan. So with these 8 guiding questions, I will end the presentation. But now the session's open for any questions that you may have following the presentation. And then we'll have a space, as I was mentioning, for sharing. So I look forward to any questions that may have come up.
Thanks so much, Vanya. I think we see one in the chat, and hopefully, again, just for people that trickled in throughout Vanya's presentation, please feel free to indicate if you have a question or comment by raising your hand, using that raise hand function along the bottom of your screen, or putting it into the chat, whichever you're most comfortable with. So I do see a question here from Emily Kearns, though, Vanya.
Yes. Emily, do you want to ask the question live since you're with us, and this can make it more engaging?
Exactly.
Nice to see faces.
You're looking at just names. Yeah, hi, good morning. This is just really wonderful. I'm involved in a dementia-friendly initiative, and I want to align with our age-friendly initiative here in Maryland in the United States. And at the root cause of all our problems, I believe, is, at least with around dementia, is ageism. And so this is really exciting. Thank you. My question is this. I'm really interested in working with diverse communities, but I'm also sensitive to the fact that ageism is really culturally specific in different communities, you know, how we relate to one another because of age and our sense of elders and also young people. So do you suggest that we start small in specific, more homogeneous groups rather than start in a bigger, more diverse workshop setting because of cultural specificity? Do you know different cultural backgrounds? Trying to manage everything at once in terms of, you know, the jargon, intersectionality, you know, but we're from different races and religions and things like this. So to me, ageism is really like at the nexus of all of this. But how do we unpack that especially I love like the role playing, for example, and the intergenerational interventions of projects. So I'll stop there, but I'm just curious about your ideas in terms of the density of the cultural pieces of this. Thank you.
Thank you so much, Emily, for a very great question. I mean, I think it would depend on the resources that you would have available and to what scale you want to go to. It's often helpful to start with a smaller type of project. That doesn't mean that it would have to be addressed to a homogeneous community. I mean, we're one of the things that I didn't mention, and thank you so much for the question, because I should have probably mentioned, is that obviously we're not just an older or a younger person. We are an older and a younger person, and then we have our gender, we may have a disability or not, and all of those factors will then can intersect and compound disadvantage. So maybe having more diverse groups can also be helpful in bringing out and teasing out those differences in the experiences that people may have of ageism as it intersects with other forms of disadvantage. And maybe different people, as you're saying, there are some cultural differences also when it comes to ageism, but we do see ageism in every country. So that could also make the discussion more interesting in terms of, I don't know, if you're thinking about an educational activity as to what misconceptions people have and why, where do they come from? Because I think one of the things that people often don't even consider, because oftentimes ageism is implicit or unconscious, we're not even aware of how ageist we are, because we've never been confronted to questions around those assumptions that we may make based on someone's age. And I think an educational activity that brings those different perspectives could, for example, be helpful. But again, it would really depend on the resources that are available, where you're based, and what may be your best type of audience for an initial activity. And of course, you can always include an educational activity with an intergenerational component or just one. But I hope that helped address the
yeah, I love it. Thank you so much. Yeah, it's really helpful to think of the possibilities of the richness rather than the constraints, you know, of bringing people together. Yeah, that's very helpful. Thank you.
Thanks.
Thanks very much, Emily. I think I see a question from Michelle Porter here. Michelle, would you like to come forward and ask your question? If she's shy, I can ask him.
If not, I can.
Sorry,
I'm reading it.
I'm working on a tablet. I'm not used to using the controls on a tablet.
Gotcha.
So just as my question states in the chat, I'm just wondering, kind of aligns with the last point of your plan of action, where what barriers and resistance might be encountered. So with the legal document of the convention, the Inter-American one that has been signed by several countries, just wondering what the reasons are for other countries not signing.
I mean, I can't speak to individual countries, but sometimes some barriers are countries just being more hesitant to sign new conventions, or not understanding what benefits it would bring, or sometimes not having sufficient general public support for the government to face that pressure that they have to sign and ratify a convention. Is the same in terms of why their different member states are in different places with regards to the possibility of having a UN convention on the rights of older persons. But again, the general public, civil society organizations have a key role to play. At the end of the day, it is up to the member state to sign or ratify. But civil society can certainly exercise a lot of pressure for change to happen. but people need to know that these things are underway, right? So people need to know in a country that there is the Inter-American Convention. People need to know that there are discussions about a UN Convention on the Rights of Older Persons, so that they can then get themselves involved in existing processes to exert pressure and hopefully get it ratified.
Thank you, that's helpful.
Thanks, Vanya. I don't see another question, but I see a comment here from Jane Burney. Jane, would you like to kind of share your thoughts?
Yeah, I can do. I mean, it all sounds great, and in the UK we are fortunate that we do have the Equality Act, so it is written in legislation. But my experience, and I'm an age-friendly principal officer working on age-friendly communities, is that ageism, especially the more subtle things, or well, I don't see them as subtle, but like a birthday card, you know, congratulations, you've reached 30, life is downhill now. You know, it's completely acceptable. You wouldn't have that for any of the other kind of isms. So that we've progressed in the UK in that way, but on the ground there is still so much ageism.
No, I definitely agree. And unfortunately, I mean, a similar birthday card or a similar card that made a joke about someone's gender would nowadays be considered completely inappropriate. And we still have such a long ways to go with regards to things that are, more subtle, but they're not that subtle anymore. And it's humor. And humor is a reflection of the ageism that exists in our society and how it's used and how it's still seen as socially acceptable. But I think it's also up to every one of us to start challenging those situations. And we have a very rich toolkit of resources that is part of the global campaign to combat ageism. And one of the resources that actually speaks to that point is a conversation guide on ageism, which aims to help every one of us have conversations about ageism in different parts of our lives. So for example, at home, you can have these conversations with your family and friends, including questions about those types of cards that we may all receive. And you can ask a friendly question as to why do you think this card is funny? And why is age a funny, like a characteristic to make fun of? And through those questions, you can start then getting people to think about those underlying assumptions that they've made all along, or those immediate jokes that we just recur to without even thinking about what that joke may mean or how harmful it can be. And again, I do encourage you to take a look at the conversation guide. I will try to leave some links on the chat so that everyone can access them before we close, including this one, because again, I think it's also up to every one of us to start challenging subtle or micro ageism, or however we want to call it, and also more blatant situations of ageism that we may see in accessing services or in interpersonal relationships. But thank you very much for that question, Jane. I agree, there is legislation in some places. There's also legislation in some places, but then people don't know about it. So there are barely any cases filed because people don't know that they can do something about it. And also one thing that I wanted to talk about is internalized ageism. So if we internalize ageism, we may consider certain things that are blatant discrimination as natural parts of the aging process. Like this is part of what it is to be an older person, or this is part of what it is to be a younger person, which means that we may not actually file a complaint when we experience certain situations of discrimination because we have normalized it. So again, there's a lot of public awareness still to be done in this area. And I hope that through the 3 strategies that we know work, including educational activities and intergenerational interventions, that we can take huge steps that are still required in this area. But thanks.
Yeah, I did put a link in for the UK Centre for Ageing Better's new publication, which people might find interesting from the point of view of the English-speaking countries.
Thanks very much, Jane. And we'll make sure, as Vanya said, some of those resources from the WHO, we'll make sure to share those as part of our post-webinar resources. So those links will also be embedded in some of those materials for your review as well. So I don't see any more questions kind of rolling in, Vanya, but I wonder whether, I know we're kind of moving to a reflection period as well, and whether you have any questions of our audience today that could potentially stimulate some discussion.
Yeah, so I was hoping that in this next part of the webinar, and we only have a few minutes, but I was hoping that some of you could share ideas or projects that you think you could help develop to address ageism based on what we discussed today. The idea here is that it's an open, friendly space for you to share, for us to kind of co-create, for others to jump in, and as I was mentioning earlier, hopefully be inspired to also do something in their communities. It can be something smaller or bigger, it doesn't matter, or it can just be an early idea, but it would be great to hear about what you're planning to do in your context. Emily.
Hi, yeah, we had a program that was really successful and I'd love to replicate it. Again, it was called Legacy Matters, and middle school kids brought their what do you call it, the iPads, and they met weekly with the senior partners or elder partners, and they were amazing. These kids were only like 12 or 13. They developed interview protocols, and yeah, which was remarkable. So I'm a sociologist, and here they were blooming sociologists. They interviewed folks, and then they basically shared stories, but they also gathered their photos and they scanned them, and then they put their cool music to it. So they basically made like videos, these legacy videos. And short story, one person passed, died in her sleep overnight, and devastated, of course, the middle school partner. And the family asked the middle school partner to come to the memorial and share the video that he had made. And it was really just simple. It wasn't rocket science, 1 hour a week. They sat, they had refreshments together and laughed together, cried together, or whatever. And a lot of times it wasn't one way. It was, sharing stories. The older person would ask the younger person, so, do you have a dog or whatever? Very simple things. But I loved what the term you used, a singularity, because I think that's what they discovered, that each person was this unique individual with this history. Anyway, I'll stop there, but it was very cool, and it didn't cost a lot of money because the middle school class, brought their own laptops, and we scanned the materials at the senior center. So that's just one offering, and it really was impactful for me, and very surprising of the impact on the participants.
No, and like you said, thank you so much for sharing that example, Emily. One thing you shared is also quite important, which is that oftentimes these activities are not necessarily very expensive. And they're not very resource intensive, both in terms of financial resources or even human resources. So they're quite accessible. So we were actually quite happy to see which strategies we found were effective, because many of us can actually implement those types of interventions regardless of the amount of resources that we have. I also really liked one thing that you mentioned, which is that it was not just a one-way kind of interaction, and this is very important. So in the report, we also flag those characteristics that can increase the effectiveness of the 3 different strategies. And one of the characteristics that we know can increase the effectiveness of intergenerational interventions is precisely that the younger and the older person who come together cooperate. So they have to have an equal status, which means that the activity that they're involved in should not kind of favor maybe the skills that the older or the younger person has, or vice versa. And also that the environment that they're in is not completely familiar to one, but completely unfamiliar to the other one, so that they have that equal status. We also know that the quality of the contact is very important. So more than having 1,000 sessions, it's important that those sessions that they do have together are of very good quality. And oftentimes, actually, the relationships that are established through the programs run well beyond the program, because they're lasting friendships. It's not just during the intergenerational intervention that the younger and the older person meet. So thank you very much for sharing that example, Emily. Are there other examples?
I've got a comment here from Stefan Vanya, and I see a hand up by Dominic. So perhaps Dominic, you can come forward with your thoughts, and then we can address Stefan's query.
Thank you very much. This is exciting. I'm really glad that I tuned into this webinar. I'm involved with a couple of things here in Nova Scotia. One of them is the Aging Well Coalition in Pictou County, where I live. And I want to bring the information from today forward to that. And I'm also involved with our Alzheimer's Society as a volunteer. And I did education and outreach for a year on a contract. And it occurs to me we've sort of got the double whammy of prejudice and discrimination when we talk about seniors who also have dementia and possibly other disabilities or conditions. So I'm going to bring this forward to the Alzheimer's Society as well, and have a discussion about. I know there is some effort on an ongoing basis to deal with the stigmas around the dementia, but I think this can kind of add to the possibilities that we have for changing attitudes about this and ending that discrimination. So I just want to thank you very much for the workshop today.
Thank you, Dominic, and thank you for raising this double burden that can happen sometimes when ableism intersects with ageism. You're very right, and actually, this is one of the few intersections that has been studied in some detail. So we have evidence of this intersection, and then ableism and ageism and sexism. Sorry. And with regards to ableism and its intersection with ageism, one of the things that we see, for example, based on the evidence, is that the programs and the policies that are considered acceptable for older people are not the ones that are considered acceptable for younger people. So for example, younger people do not find it acceptable to be left in an institution, but that is considered as an acceptable approach when you see this intersection between ageism and ableism with regards to older people with a disability. The same expenditures are not the same. So in many countries, we see more expenditures for younger people with a disability than for older people with a disability, even though we know that disability is more common in older age. So again, there's a lot of work to do here, and some of the stereotypes actually that we see are applied to older people are similar to those that are then applied to people with disabilities. So there's a lot of work to be done here. And of course, working together with the Alzheimer's Association would be a great step forward. We also see that a lot of the programs that involve an intergenerational aspect, or some of them, at least take place in long-term care institutions, for example. So they bring together, for example, children and people who are in a long-term care institution to try to foster that interaction between people of different ages. So there are a lot of opportunities that I can already think of given your current position in terms of what you can do moving forward. But thanks so much for sharing.
Thank you.
Vanya, I wonder, I'm going to put you on the spot here a little bit, but I know that WHO has been working quite extensively lately on kind of dementia inclusive societies, and has, I think, recently released a toolkit. I'm wondering if you can speak at all to kind of the synergies between kind of your work in ageism and the kind of dementia inclusive societies, and whether and to what extent kind of ageism is integrated within some of the resources for dementia inclusive societies.
So we work closely, so we're based in different departments, but we work closely with the people who are working on dementia, and we try to cross-fertilize the programs that we have in place that are directly addressed to ageism or age-friendly environments, actually, and the programs that they have in place for dementia-friendly initiatives. And even more so now that we're walking this path of the UN Decade of Healthy Aging that just started this year, and will span up to 2030. So we're trying to identify synergies and entry points in both of the agendas so that we don't forget about those opportunities that may exist in different communities around the world. So of course, we try to integrate.
Thanks very much, Vanya. We probably have time for one more comment, and I see a comment here from Michelle Lewis. I'm wondering whether, Michelle, you'd like to come forward and kind of share your comment.
Hi, can you hear me?
Yeah, we can hear you perfectly.
You can hear or see me. Hi there. Yeah, so I work for the Older People's Commissioner's Office in Wales. So I lead on the age discrimination and ageism work for the Commissioner. And we have a range of projects, but one in particular is working with parliamentarians, so members of the Welsh Parliament, to bring together a range of organisations and individuals, both older people and younger people, to look at how we kind of develop intergenerational solidarity, how we can kind of extend the things that we all have in common and share those views and kind of prioritize those, but also think about how we can use that to shape policy decisions. So when Welsh Government is making decisions, how they consider the intergenerational impact of those to make sure that they're kind of bringing generations together more effectively rather than dividing them. So it's, you know, it's still in its early days. We've got a number of different work strands within that group, one of which is around ageism. So happy to keep you all posted on that as it develops.
Yes, that would
Yeah,
be great. Oh, sorry, I didn't know if you were.
Yeah, no, I was finished. Sorry, I was just going to say, yeah, we can keep you posted.
No, this is great. And again, one of the things that we do see with regards to ageism is that oftentimes both the media and sometimes politicians try to create this divide between generations. So I am so happy to hear, Michelle, of the work that you're doing to try to make sure not only that they're not fostering this imaginary divide oftentimes, or pushing for a divide that then the individuals themselves do not necessarily see. And also the fact that you're pushing for both younger and older people to have a seat at the table in those decisions, and that they come together. In terms of sharing, one of the things that I also wanted to say before the end of today is that we have a platform for the Decade of Healthy Aging that has a hub on ageism, where you can share all of your initiatives that you're doing on ageism, reports. You can share personal stories of ageism, or they can be negative or positive. So it can be a positive story of change that happened after, I don't know, an educational intervention was implemented in your community. And again, we will all be able to learn from those initiatives. And it's also a great place for you to learn about what other people are doing. And eventually the idea is that we also create communities of practice within the platform for the Decade of Healthy Aging, so that you can connect with people who are doing similar work or very different work. So I will post that link as well. So I'm realizing that we're running out of time and I need to post a lot of links. But thank you so much for sharing, Michelle.
Thanks very much, Vanya. I'll give you a second just to think about some closing remarks. But I think we have a couple seconds left, and I know, Stefan, you're eager to ask your question. So if you can keep it super tight for me, we'll try to squeeze you in for one last question here.
Sure. Do you want me to talk now, or do you
Yeah,
want Vanya?
absolutely.
Oh, okay.
Nope, go for it.
Well, you know, we're talking a lot about what I would call, you know, specific areas that need attention, and that's quite obvious. I come more from the theoretical place, and I don't think that much has happened. I started an organization called Creative Aging back in the 80s, and we did research. And when we had people draw a kind of a graph of their perception about what age is, it was a bell-shaped curve with the peak being around 35, 40, and then a decline. So that's the way they visualized aging. And I think that context is very important. And at this point, young people aren't excited about getting older. Middle-aged people aren't excited about getting older. And so I think that I'm looking for people who are interested in the theory of lifespan and what role does that third stage of life actually have in lifespan. And I believe that it can be potentially the most powerful, most productive, most loving time of our lives. And I think it's important that we also attend to the ideas out there that are floating around, or is really not too many ideas are floating around, except for more negative ideas about aging as opposed to really positive. And just sticking the word creative or conscious or graceful aging, you know, in front of the word aging doesn't make it so. We have to kind of explain why it is something that people can look forward to. So if there's any people who are interested in the theoretical aspect of lifespan and aging, you know, it was up to the Black people to come up with Black is Beautiful, and it made a huge difference to their sense of self, self-worth, self-esteem. And I think we need to look at that aspect of aging as well.
Thanks very much, Stefan. Perhaps you can put some of your contact details into the chat, and we can you can kind of continue a conversation offline.
Thank you.
Yes.
That would be great. And if I can react to that, Stefan, thank you so much for your intervention. I definitely agree. There's a common saying that says that we all want to live a long life, but we don't want to be an older person. And that very much speaks to what you're saying. It's quite unfortunate in the sense of how older age is portrayed, and the fact that people just reject even thinking about themselves in older age. And I think that's part of that process that I think we can help change through interventions like education at an early age. As I mentioned earlier today, around the age of 4, we're already aware of the age stereotypes that exist in our culture, and we start using them from that age onwards. Unless we change how we perceive different life stages from that early age, it's going to be very difficult that we grow up with great expectations about ourselves in older age. So I very much agree that a lot of work still needs to be done to see how we portray older age and how we see ourselves aging. But again, thank you so much for that remark. Changing the discourse around age and aging is part of the work that we're doing at WHO as well. And I hope that in the coming years, we can make a lot of change and hopefully count with the support of all of the participants here today to take action also in your settings.
Thanks so much, Vanya. I just wanted to take a quick moment to let everybody know that this is the second webinar in a series of 3. So we'll have a third webinar. We'll break off for the holidays and then come back and probably meet, I would say, in the end of March. We'll make sure that we communicate the exact date and time to all of you in kind of previous or similar communication as we've done in the past. And now I really just want to hand things over to Vanya and kind of if there's any key takeaways you want us to leave with today, Vanya, and just to thank you for your time and everybody who has attended today. Thank you so much. Vanya, the floor is yours.
Thank you so much, Anna. I mean, I did want to say that that I encourage all of you to join that last webinar, because it will be a time for sharing what you have done since this webinar, so that again the momentum can continue. And so that others can learn about existing initiatives that are already running. So I do encourage all of you here today to join us for that last one. And I just wanted to conclude by saying that the time to act is now. Unfortunately, ageism has been unchallenged for way too long. I mean, just think that the term was coined 50 years ago, and we're still here with both very evident and more subtle ageism very present in our societies, and that I hope that all of you join the movement to create the world for all ages that we all want to live in. So thank you very much for your attention. And I hope that you found the workshop helpful and that you have some ideas that you can go away with in terms of what you can do in your context.
Thank you so much, Vanya. And thank you everyone for joining. We'll see you next time.